Hello, everybody. I am Branu. Today I am interested to uh, discuss or present one topic that is administration of medication. So this area of health care service is one of the crucial or important areas. So I am interested to present on the medication administration. Uh, I have objectives for this presentation. At the end of this lesson, you will able to describe what is medication administration, uh, mention the general rules and the care of administrating medications, list various route of drug administrations, identify the part and the types of syringes and the needles. This is my objectives. Now let's go to what's medication itself. Medication is any substance that may be prescribed by a healthcare practitioner in order to help, to treat, to relieve, to cure the cause of a client's health change in order to prevent this change. This is what is medication. Uh, there is other terms which is used in the medication administration. Drug is another terminology that we use. Drug, when we say drug, is any substance that's when it taken into the living organism, it may be have the potential to modify one or more of the body functions. Uh, it might have a potential of affecting health as it alter physiological functions. Medications are a drug that administrate for its therapeutic effect. Uh, and this all medications are a drug, but all drugs are not medication. What we mean when we say this, any drugs, not medication, but when the drug is taken and it has effect of therapeutic, that's drug is medication. Uh, Medication management requires a collaborative effort for many healthcare providers, not alone activity or medication may be prescribed by physicians, health officers, dentists, or other authorized prescribers such as like as advanced practice registered nurses as may be determined by individual licensed bodies. After the drug or the medication is prescribed, uh, that may be administered, the pharmacists are licensed to prepare and dispense the medication. The nurses are responsible for administering medication. Others professionals also have the role of administrating medication. Uh, Among the healthcare, the health professionals, nurses are the main or the primary responsible to administrate most of the medications. The administrating of the medication may need the knowledge that's based about the drugs. The one who going to administrate medication must know what is drugs, including its name, preparation, classification, adverse effect, physiological factors that affect drug actions. In preparing and administrating medication, for the sake of the safety of the patient, there are three checks and five R's or five rights. One who administrates medication must know these three checks. Some literatures may add other checks, but popularly or commonly, there are three checks. These checks are when the one who administrates medication, when he reach to the container, he must check immediately prior to medication, must check the drugs when replacing the container to the drawer or on the shelf. The one who administrates medication must check three times. These checks it is helpful because if there is a medication errors, the one who administrates medication, there may be takes a measure in order to reverse the errors. The five R's to protect the clients from medication errors, we have traditionally used as a guideline the five rights of drug administration. Some authors or some literatures it lists up to 10 rights by classifying the R's, but mainly we use the 5 R's which we list here. There is a right drugs, right dose, right lengths, right route, and the right times. Sometimes some authors add the 6 rights, which we add documentation. Documentation, uh, documentation of drug administration is a critical element of drug administration in documentation. Uh, as a standard, it says if it, it was not documented, it was not done. Many drug errors can avoided with appropriate documentation. If we well documented, just we minimize the chance of drug errors. The other thing is when we are administrating the medication, we use some special equipments or items such as syringe, needles, ampules, and the vials when we are administrating parenteral medication. My today's lesson or presentation is focused on the parenteral medication administration because of this material is the most important material. Most of the time we may miss knowing about this material, so I want to discuss what is this material. Syringes are uh, prepared from a plastic material and has 3 basic parts: the hub, which connect the needle, the barrel, the outer side part of the, which contains the measurement calibration, and the plunger, which fits inside the barrel and has a rubber tips. Uh, when we use this equipment or items, must ensure that the hub inside of the barrel and the shaft of the uh, rubber plunger tips must be kept sterile. When handling the syringe, you should touch only the outside part of the barrel and the plunger handler. Most syringes are disposable, made of plastic material, individually packed for sterility. These are the pictures which shows us different types of syringes. The first one is hypodermic syringe. The second one is insulin syringe. The other is hypodermic syringe. The last one is disposable syringe. Nowadays, we use the disposable syringe. This disposable syringe may have different varieties. The one who going to administrate the medication through parenteral medication must know the variety of types of syringes. Needles is another issue or which we must know during administrating medication. Most needles are disposable, made of stainless steels, and individually packed for sterility. The needles has the same as syringe. They have 3 basic parts: the hub, which fit to the syringe, the cannula or the shaft, which is attached to the hub, and the bevels, which is slattered part of the tip of the shaft. Needles comes in various size. Most of the time, most health professionals they may not this much concern about the size of the needles. Uh, Needles may be measured in inch, 1/4 inch to 5 inch, and the gauge that ranges from 28 to 40 gauge. The inch is measured the length, whereas the gauge is measured the diameter of the needles. Uh, the large length needles may be used for those fat claims, whereas the large needle gauge is used to administrate those thick medication. These are also another part of the medication administration concern, ampules and the vials. Most of the time, while we are handling this material, we are not this much concerned. Because of this, it is necessary to know what is ampules and the vials. Drugs, for parenteral injections are sterile preparation because of these drugs that may deteriorate in a solution are dispensed as a tablet or powder and dissolved in a solution immediately before injection. Drugs that remain stable in solution are dispensed in ampoules and vials in aqueous or oily solution or suspension. Ampoules are glass which contain container of a single dose of drugs. As you look on the picture, uh, these are different types of ampoules. The glass containers has a constricting in the stems to facilitate the opening of the glass. Uh, most of the health professionals they may have not concern about the neck of these ampoules, but there is a different marks on the these ampoules. Just by using the marks, we can easily break and open the ampoules in order to administrate the medication. The other is vials. Vials are a glass, a single or multiple dose, rubber capped glass containers are called vials. The vials is usually covered with a soft metal cap that can be easily removed. As you see on the pictures, there are different types of vials which contains a single dose or multi-drug dose. There are different route of drug administration. Drugs are available in many forms of administrating by basic routes. The routes, when we say the route, is it refers how the drug is absorbed. There is a parenteral route, oral route, topical, and inhalation route are a different route of drug administration. Our today concern is about the parenteral drug administration route. The others maybe we face other times. So I discuss the parenteral drug administration. Parenteral drug administration. Parenteral drug administration are given through the route other than the alimentary canal. These routes are there is intradermal routes, subcutaneous routes, muscular route, and the IV intravenous route. The angle of injection and the depth of the penetration will indicate the types of the injection. You should provide the clients with explanation of various routes and used when administrating parenteral drug administration. Angle of drug administration, the angle of insertion depending on the type of injection. As we see on the figure, there's intramuscular drug administration, which is 90 degree. Subcutaneous route is at 45 degree. When we administrate intravenous injection at 25 degree for intradermal injection, it ranges from 10 to 15 degrees. Just we hold the needle and the syringe at this angle. When we prepare in this manner, just we appropriately administrate the injection. Also on this picture, not only the angles, it shows us the depth of the needles. For example, if we take intramuscular, the needle is goes up to the muscle on the yellow part. The red part, subcutaneous injection, it goes to the yellow part. The vein, also the needle is penetrating to the vein. The intradermal, also under the dermis. The intradermal injection is an injection given on the outer layer of the skin or injection given to the dermis. It has the lowest absorption from all parenteral administration because there is a less blood vessels in the dermis. Because of this, it is less absorption when we are comparing to the other types of parenteral drug administration. The purpose is to for therapeutic purpose, like as administrating BCG vaccine, for diagnostic purpose, tuberculin test, allergy test, like as DAT test. These are the body sites where we administrate the intradermal injection. The site commonly used for intradermal are the inner aspect of the forearm. This is the commonest area which is visible while we are administrating or to check this area, except when there is no highly pigmented or covered with hair. The other side is upper chest and upper back and the bends the scapula. Amount of the solution also must be known, usually less than 0.5 ml, 0.1 to 0.2 ml. The syringe of 1 ml with 25 to 28 gauge needle is used. During the intradermal medication administration, must prescriptions after administrating the drug, there may be not massaging the site after the injection. Contradiction for non-allergy patient, HIV patient for BCG vaccine. Subcutaneous injection is route is another route of drug administration, parenteral drug administration, injection of drug under the skin into the subcutaneous tissue. The absorption is usually slow, sustained, and complete. 2 ml syringe with 25 needle is used. Usually, amount of solution is 0.5 to 1 ml. This route is most of the time it is used to administrate medication for sustained absorption rate, because subcutaneous injection there is no this much abundant blood vessels because of the drug is absorbed slowly. That is one of the purpose of subcutaneous drug administration. The purpose is for quick absorption. If oral medication is impossible, like as insulin, those hormone drugs not tolerate the GI secretion. Because of this, it administrates subcutaneously. Body sites for subcutaneous injection: abdomen, lateral and the anterior aspect of the upper arm and the thigh, scapula area on the back, upper ventral-dorsal gluteal area are some of the site for subcutaneous injection, as we seen on the picture. Intramuscular injection is the third parenteral drug administration routes. Administration or introduction of drug into the body by a muscle tissue. This is the definition of intramuscular injection. It is used for irritating drug to the subcutaneous tissue, as it deep muscle has few nerve linking. When we are comparing with subcutaneous tissue, the muscle has a few nerve ending. Because of this, those irritating drugs administrating into the muscle, its absorption is fast because it is vascular. When we are comparing with subcutaneous injection, intramuscular injection is the absorption rate is fast because it is highly vascular. Amount of drug for intramuscular which is recommended is 4 to 5 ml is considered as a maximum amount of drug injection. The purpose of intramuscular injection is if the drug is related to the other route to get quick action as it is absorbed quickly. Contraindication: when there is a clot disorder patient, IM injection is not recommended. Complication: there is a pain, discomfort, infection, tissue damage, nerve or vessels damage, bleeding, and allergy are some of the complications of IM injection. Body site for IM injection: dorsogluteal, the commonest site for IM injection, on the buttock. Methods to locate this site is divided the buttock into 4 sections by drawing imaginary line vertically between the crusts of the ilium and the gluteal fold. Then from the medial fold of the buttock, draw imaginary horizontal line to the lateral aspect. The outer upper quadrant is the site of the injection. There is another or second method of identifying this site. There is drawing of imaginary line between the greater trochanter and the posterior superior iliac spine. The injection site is slightly above the line medially, as we seen on the picture. There is different lines. For the first one is the injection site is on the left side. On the right side for the second method. Retrogluteal site is the second IM injection site. Can be used for both children and adults. It has no large nerves and blood vessels. The client can be on the back or side laying on the abdomen. Place the right hand on the patient's left leg, greater trochanter pointing your index finger to anterior superior iliac spine and the mid finger to the crest of the ilium. Injection site is between the two fingers. As we see on the picture, just when we put our fingers on this side, it makes a letter of V. The injection site is at the this V-shaped site. On the picture, as you see, the yellow color is the site for the injection on both pictures. Vectus lateralis is the third IM injection site, the thick muscle on the lateral aspect of the thigh, recommended for medication administration. It has little or no danger of serious injury. It identifies the greater trochanter. Place the hand at a lateral femoral condyle. Injection site is middle third of the anterior lateral aspect. As you observe on the picture, the yellow part is the injection site. This injection site is recommended most of the time for administrating for children. Rectus femoris, the fourth route of IM injection, is one on the anterior part of the thigh. It is used only when other parts are contraindicated, as most patients found is as comfortable. The rectus femoris, when there's another option is not available, this site is recommended on the third of the upper thigh is the injection site. The other IM injection site is deltoid muscle, is one on the lateral aspect of the upper arm. It is a small muscle. It has less potential for absorbing large amount of solution. So injection should be limited 1 ml and used only for adults. It has a risk to damage radial nerve and the artery. This is a deltoid muscle injection site. This site is located bilateral side of the humerus from the 2 to 3 fingers width below the acromion process. In the adult, 1 finger width below acromion process for children. There is another big issue which is not known by many health professionals about Z-track detection techniques. This technique is used for those drugs irritating to the muscle. It administrating with these techniques. This technique is administrating as you is observing on the picture. The patient is placed on his abdomen. Then we taut the muscle and inject the material into the muscle. Then by releasing the pinched muscle and administrate the medication, as you see on the picture, there is forms a zigzag when we are removing this the drug that may less the irritating effect of the drug. Administrative intramuscular injection using Z traction technique, cleanse lies prone with buttock is exposed, grasp and pull the muscle laterally before injecting medication. Pull the skin, taut and then release it after the needle is withdrawn, seals the site. The another parenteral drug administration is intravenous injection. It is an introducing of the drug directly into the vein. The amount of the drug which is administrating intravenous is 10 to 20 ml solution at a once. It has the fastest action. The purpose is for the when a quick action is needed, like as emergency case, when the drug is irritating to the body tissue, if it is given by others. The intravenous injection, it recommends 10 to 20 ml. When this amount is exceed above this, the drug must administrate through intravenous infusion. It is an administration of large amount of solution or fluid into the circulatory system through the vein. The purpose is to maintain a fluid and electrolyte balance. to maintain acid-base balance, to introduce medication like as antibiotic or vitamins, to provide calorie when the patient is under the NPO, netting per hours, to maintain an access to circulatory system when the patient is taking intermittent medication. Uh, just when we administrate intravenous medication, uh, just there's a calculation in order to administrate this IV infusion. There is a formula, a number of ml of solution times a number of drops divided by the number of hours in minutes. Uh, this is an example. If there is a 5% DW is or dextrose in water is recommended or administered to run for 12 hours, the calculating drops per minute to finish over the given time, then the DW is 1000 times 50 drops divided by drops per minute. We get 20.83, which is around 21 drops per minute. Drops may be get from the cannula, which we are administrating for IV infusion. Just after we securing the IV solution or IV fluid, administrating and calculating this, finally at the end we replace the used equipment, washes our hands, record the procedure, observe the patients and monitor the flow rates. This is what I have today. Thank you very much for your watching.